Bernie.
Well, Mr. Speaker, I know Groundhog Day is not until Thursday, but it sure feels like it, I'm sure, for you, because I keep having to drag the government in here at the end of the day to answer to Canadians of why they haven't delivered on their mental health transfer. Mr. Speaker, we have a system that is overburdened and stretched to the max. And I just had the leader of the NDP in my riding. We went to a roundtable on seniors' health. We listened, Mr. Speaker, to the stresses on the system, in long-term care, in the healthcare system. But we also heard from physicians. And you know this, Mr. Speaker, and you're riding too. Physicians are saying that they don't have the supports when it comes to mental health, when it comes to social workers, psychotherapy, and it's causing a huge, huge unnecessary burden on the healthcare system. It's backing up our ERs, Mr. Speaker. We heard that directly from physicians. I met with the Nutala Tribal Council, with the Huayet First Nation, Hupachesit and Sashat, Mr. Speaker, at Sashat, who hosted a meeting, and they said their top priority is ensuring that there's mental health supports. And Mr. Speaker, we will kick and scream and drag the government back here every night, New Democrats, if we have to, until this transfer is delivered. We'll use every tool in the toolbox. They promised, Mr. Speaker, $4.5 billion of new money over 5 years to help support those with mental health issues. I also, Mr. Speaker, heard from not just First Nations, but I actually went in my own doctor's office and I asked my doctor how it was impacting him and serving his clients and the overall community. He said, Mr. Speaker, that over 50% of the people that were coming in his office were either having a health-related issue related to mental health or substance use. He says, I can't be a social worker. He says, people are leaving the field. He said, nurses are leaving the field. So, Mr. Speaker, right now in a health crisis, we need to do everything we can to take the pressure off those that need supports that are physical related and ensure those that have mental health issues are getting supports that are mental health related. Meanwhile, people are dying. Mr. Speaker, I got a message from a good friend of mine who lost her son this week. She said, we need treatment centers, not more police. We need investments, Mr. Speaker, in mental health supports. This government keeps promising, Mr. Speaker, they're going to deliver that. Now, there was a joint report by the Mental Health Commission of Canada and the Canadian Centre on Substance Use and Addiction. They found that almost 35% of residents reported moderate to severe mental health concerns. That's, less than 1 in 3 people experiencing mental health were accessing services. And they said that financial constraints were a big part of that, Mr. Speaker. And as we know, we're potentially heading into a recession. People are struggling. Mental health issues are getting worse. And now, establishing the Canada Mental Health Transfer was a key election promise, Mr. Speaker. This was the second on the list to the mandate letter for the Minister of Mental Health and Addictions. They promised $875 million would be transferred by 2023. Not a dollar of new money, Mr. Speaker. What we're going to hear from the government, they're going to pat themselves on the back from old money. They're not going to have delivered on the new money they promised. It hasn't happened, Mr. Speaker. It's costing lives. People are dying, and it's unnecessary. The government needs to do the right thing. They're wastefully spending money instead of prioritizing the health of Canadians, taking pressure off our healthcare system, and investing in mental health when Canadians need it the most.
The Honourable Parliamentary Secretary to the Minister of Health and Addictions.
Thank you, Mr. Speaker. Je veux remercier le
I want to thank the member for Courtenay-Alberni for giving me this opportunity to speak about this important issue and to explain to this House how we are supporting mental health and substance use services for Canadians.
Même si il est tard.
And I'm happy to speak at this late hour.
This is why we have made historic investments to support mental health care and substance use care needs, including $5 billion over 10 years to improve Canadians' access to mental health and substance use services directly to provinces and territories through bilateral agreements. Ces ententes offrent en ce moment.
These agreements currently provide provinces and territories with $600 million annually until 2027. This funding helps expand access to mental health care and addiction services for youth, integrated services for people with complex needs, and this funding also increases access to proven community mental health care models and culturally appropriate interventions that are linked to primary care services.
All provincial and territorial health and mental health ministers agree on the importance of promoting mental wellness and addressing gaps in mental health and addiction services and recovery. In November, the minister met her counterparts across the country to discuss these key points. Through these bilateral agreements, the FPT health and mental health ministers are working together to improve access to evidence-supported mental health and addiction services and supports for Canadians and their families. We also acted quickly to respond to the increased demand for mental health services and supports arising from the pandemic.
At the beginning of the pandemic, we launched Canada's Wellness Space, offering free, confidential, online mental health support, which is available 24/7 to individuals across Canada in both official languages. More than 3.1 million people have accessed Wellness Space online, and its companion application, Wellness, has been downloaded more than 35,000 times.
Provide $140 million for the Wellness Together Canada portal so it can continue to provide Canadians with tools and services to support their mental health and well-being.
We recognize that some groups have had their mental health disproportionately affected by the pandemic. We are providing $100 million over 3 years to support dedicated mental health projects and an additional $50 million over 2 years for mental health programs to support groups at high risk of trauma as a result of the pandemic.
In addition, Budget 2022 will provide $227.6 million over 2 years to maintain a trauma-informed, Indigenous-led, culturally appropriate services to improve mental wellness and continue to implement distinctions-based mental health and wellness strategies. However, we know more needs to be done to ensure Canadians can access to high-quality mental health care and substance use services they need and deserve, both now and in the future. Prime Minister will be meeting with premiers next week to ensure the sustainability of our healthcare system for years to come, and that further investments deliver tangible, positive outcomes.
The Honourable Member for Courtenay-Alberni.
Well, like I said, we know Thursday's Groundhog Day, but the government decided that today's Groundhog Day. We heard the same response, Mr. Speaker, same old thing, to patting themselves on the back about money that they promised from before that they're spending. But look at the results. The results speak for themselves, Mr. Speaker. Overcrowded ERs, doctors having to do social work that need help, Mr. Speaker. People are dying as a result of this government's inaction. They failed to deliver a dollar of the promised new money, Mr. Speaker. Now, I actually don't believe they're going to do it. The Prime Minister has directed his ministers to spend less money, and I think he's going to cut, Mr. Speaker. They have no intention of delivering on this transfer. It's been over a year and a half. The UK and France, they spend about 12% on mental health funding. We spend between 5 and 7%. It's time for this government to respond. They need to answer to Canadians why they haven't delivered on this promise. I'll be back, Mr. Speaker. I'll be back at every opportunity ensured to hold them to account until they deliver the mental health supports that people desperately need.